Mr. Smith. How are you?
Hi, I'm well, thank you.
As you know, I'm your nurse, Sabrina. We've been working alongside, taking care of you for the last couple of weeks.
Right.
So, are you okay to have this discussion right now? Are you feeling any discomfort, any pain?
No, the nurse was just by and gave me my meds just a short while ago.
Okay, perfect. You have been recently diagnosed with the right-sided heart failure, correct?
Yes.
And how have you been feeling about this illness?
Well, to be honest with you, it's been tough. Oh, 1 second here. Let me get my glasses. Okay. Sorry, it's been, it's harder for me to actually see without my glasses.
That's fine.
So to be honest with you, it's actually been tough. I'm not as strong as I once was. It's getting harder for me to walk long distance. I got shortness of breath, and there's been a buildup of fluids in both in my neck and in my ankles and legs.
Right.
In addition to that, then there was a horrendous pain in my stomach, and my stomach was hardened and kind of distended is what the nurse described it as.
That's perfect. I really like how you wrote down your symptoms here. So, you're keeping track of how you've been feeling these past days. So that's really good. So what you were describing were the common signs of the heart failure. As you know, there are ways that we can manage your illness. So it's actually here in this book here that I want to talk to you about how you'll be dealing with this at home.
Okay, perfect.
Okay. So again, we just want to go over what heart failure is. So here the list of common causes, if you're curious, the signs, but you've experienced majority of these signs here.
Yeah, there's hypertension. I was diagnosed with hypertension. That was one of the first things that I was diagnosed.
And how many years ago was that?
Oh, 6 or 7 years ago.
Okay. So yeah, and then this brochure over here talks more. So managing at home. So how is your home life?
Things have been hard after my wife died, but my adult daughter, she stops by and she helps out. She comes by about 3 times a week, and she helps out around the house, and she does some food prep, and she brings the best meals.
Okay. So I want to talk about the important signs and symptoms you should be aware of.
Okay.
So we call them, there's a green zone, there's a yellow zone, and there's a red zone.
Oh, okay. I think I might know what the green zone might look like.
Okay.
So would that be, so I'm not going to have the buildup of fluids in my legs or in my ankles or in my neck. I'm not going to have the shortness of breath or any chest pain?
Right. Yeah.
Okay,
very good.
good.
And also, no weight gain more than 4 pounds over 2 days.
Oh, that's good to know.
As you know, we were weighing you here at the hospital.
Yes, I remember.
Yeah.
Every day I was getting weighed, so would I just continue on with that every day before breakfast or before I use the washroom?
Yes, perfect. That's definitely for sure. So you know why we are weighing you, correct?
Yes, to see if there's any buildup of fluid and weight gain, being shown by weight gain.
Yeah. So we want to make sure there's no extra fluid in your body, which will thus make your heart work harder, and we don't obviously want that, no.
Yeah, that's not good.
Yeah, so your green zone, that's very good. Your yellow zone, this is more of a caution warning sign. So if you experience any of these following, please go see your healthcare provider as soon as possible. Okay?
Like what?
Like I said, if you've gained over the 4 pounds, definitely go see your doctor. If you have been vomiting and or diarrhea that lasts more than 2 days, if you feel more short of breath than usual, the swelling has increased significantly, and if you feel dizzy, uneasy, just feel like something's not right, definitely.
So you said go to the doctor, or I'll just go to the hospital?
Actually, this is more, like I said, it's more of a caution, so you can definitely go see your doctor. The thing is, we do want you to come to emergency when you are in the red zone.
Oh, okay.
So
what does that mean?
So that's when you're struggling to breathe, your shortness of breath does not go away, you fainted, you're having trouble thinking clearly, you're feeling confused.
Oh, okay.
Do you understand?
Yeah, definitely. I'll call 911 right away.
Yeah. So here's this sheet that actually helps you monitor your signs and symptoms. So if you have any changes in your breathing, you can write down your weight here. You can write down if you have any swelling, fatigue, the side effects of any medication, anything you've done to help ease your body.
I actually have I actually have a lot of apps on my phone. I wonder if there's anything out there.
Actually, that's a good point. If you have, there is the app called Medley for heart failure,
Okay, I'll look that up right away.
and it's this exact chart that you can use, and you can just log it into your phone. Easy, simple. And then when you go see your physician after the first week of being at home for your checkup, you know, you can definitely show him this work that you've been.
Yeah,
writing
that's
down.
way easier. Thank you.
Yeah. So, like you said earlier, your daughter is bringing your meals. So, how is your eating style?
When she's around, it's great, but if she's not around, I'm just eating a lot of TV dinners.
So microwave foods.
Yeah.
Yeah. So those are high in salt.
How do I avoid that?
Okay. So, because we want to, you know, limit your salt, that means decreasing the amount of water you're retaining. We want to make sure you're eating fresh foods. You know, you're not eating more than 2,000 milligrams of salt a day.
Okay.
You want to stay away from processed food, deli meats, pickled food, salted snacks, and like chips, pretzels, and other stuff.
Oh, these lifestyle changes are going to be hard.
Yeah, for sure. And also, you know, you want to talk about your fluid intake.
Okay.
Do you remember how much you've been drinking recently?
I usually drink about 8 glasses a day.
Okay, so we want to stay about 6 to 8 glasses a day.
Okay.
But remember, fluids also constitute as water, ice, milk, coffee, alcohol. So any fluid, we want to restrict that to a total of 2 liters a day.
Oh, so this is life-changing.
It is going to be difficult, yes. That's why we do have a lot of information for you to look
Okay,
at
perfect.
when you're home. So tell me about your activity levels.
I'm trying to do as much walking and everything, but it's just so challenging with the shortness of breath.
Yeah, definitely. And you've been working with the physiotherapist to, you know, increase that and try to get you more stronger. But it's very crucial that you try to stay as active as possible. What are some things you can do at home to stay more active?
I can continue with the walking now that I'm on the pain medications and other meds. But I can do some gardening, some light vacuuming. Let's see, I can do some laundry, and definitely start doing more stretching.
Yeah, definitely. Very good. But we do want to avoid you pushing or lifting any heavy weights. Okay. You know, climbing a lot of stairs will be very difficult for you, and also try not to go into any saunas or hot tubs.
Oh no, I do that to relax, but I guess that's related to the hypertension.
Yeah, and also, you know, you trying to want to get as much oxygen as possible.
Okay.
So next we're going to talk about medication. So you are on a lot of medications, so it will be overwhelming. So this brochure here kind of outlines what you're taking.
Okay.
And-
Can you explain a couple?
Yeah, so one of them would be the Rampro.
Okay.
So it's an ACE inhibitor. So it will help improve your quality of life. You know, it will slow the progress of your heart failure, increase your energy, reduce the swelling.
Perfect. Okay.
So it definitely will help.
And what else?
You are,
Can you explain?
I believe, also what I've seen on your chart, you're also on digoxin.
Okay. And what does that do?
As well, it slows your heart rate, makes your heartbeat stronger. You know, you'll be feeling less tired. You'll feel stronger. So definitely should help. There are some side effects to that medication. So any of these listed here, definitely
Okay.
go contact or see your healthcare professional.
I'll make sure I read over that after.
Yeah, because it is a lot of information, so I don't want to overwhelm you. You can definitely look at this at home.
Okay. Thank you.
Okay. Now, I do want to talk to you about smoking. Are you a smoker?
I am.
Okay, and have you know, any plans to quit?
I was just going to limit it. I was going to slow down. I was smoking a pack and a half, so I think I'll just slow down to a few.
Okay, I just want to advise you that smoking 1 cigarette a day can reverse the effects of 24 hours worth of treatment.
Really? Well, I'll just quit cold turkey then.
Okay, you know, you can try that, but definitely you can see your physician about getting some nicotine patches. There's nicotine gums. There's definitely a lot of forms of other treatment than going cold turkey.
Oh, so there's a lot of help out there.
Yeah, so actually in this booklet as well, there's a website you can refer to, www.quitnow.ca.
Okay,
So
perfect.
we provide more information if you're wondering on process of quitting smoking, and definitely there's some support groups that they have.
Thank
know,
you.
because it will be difficult.
Yeah. Oh, yeah. These
Okay.
life changes are going to be so hard.
I understand. So this is yours to take home.
Thank you.
So it has all the information we just went over. And, if you forget anything, you can definitely refer back to that.
Or contact you as well.
Yes,
Thank
definitely.
you.
The hospital number is also on the inside of the book if you just open there. And it shows, the extension to call.
Okay, perfect.
Okay, so I just want to review what we've talked about today. So you want to make sure that you're weighing yourself 7 days a week. You're limiting yourself to 6 to 8 glasses of of fluid a day. Try to stay as healthy as possible, recognizing your signs and symptoms.
Okay.
Modifying your diet. Again, about your diet, is it possible for your daughter to come in? Is she coming in later today?
Yes, she is. She'll be here shortly.
Okay, perfect. So if she has a chance, I would like to talk to her about the foods that she's making you.
Yeah, that would be great because she's the biggest part of my support group.
Yeah, so we can definitely talk about what she's making for you to make sure that you are on your sodium restrictions. And also, the pharmacist will be making you the pill organizer so you can know, which pills you're taking because you are on a lot of pills now.
Oh, yeah, you mentioned that. The blister pack. Perfect.
Yeah.
That'll be a big help.
So, it will definitely point out what are your meds and when to take them. Okay, and before you leave today, if you don't mind, I'd like you to fill out this questionnaire
Okay.
about your learning for today. So here's a pen.
Thank you.
Based on the results of the questionnaire, I'm very happy with the results. You were able to, the goal today was that you'd understand about the lifestyle changes you need to make in order to manage. So the results show that you understand, so that's very good. It was very good that you were asking questions that shows your learning, and also I was able to observe that you gave me your full attention, so I really appreciate that.
Thank you.
Thank you.
I appreciate it too.
Thank you.